So here we've got Mr. Otto's pelvis and sacrum, and what we're going to do is palpate the actual SI joint. So the actual SI joint is a place that, it's one of these places that we go to when we're working with clients who have low back pain. So it's important to know where you're at, to know the bony landmarks, and eventually you'll know what to do with these territories. So first thing to do is to find this bony protrusion, and we've got two of them, one on either side, and this is the posterior superior iliac spine, the PSIS. And what I usually do is I'll put my thumbs on the PSIS just like that, and then from there I'll go medially. So let's say, for example, I'm doing the Mr. Otto's left side. I find the PSIS, and then I'll go medially. Now, humans may not necessarily be structured or shaped exactly like Mr. Otto. Sometimes we'll have the sacrum be a little more flush to the PSIS. Sometimes it'll be a little deeper. But what I end up doing is finding that PSIS and then moving medially to get to the sacrum. So this little nook between sacrum and ilium is the SI joint, the sacroiliac joint, right in here. Now we won't go into assessing for SI joint restrictions or how to actually bring about some freedom in there or greater range of motion. Right now, what we want to do is just palpate and find that SI joint territory. I'm using my thumbs. Sometimes you'll use your fingers if the client is in prone position and they're on the table. I may use my fingers and just sink in, find the PSIS and just sink in like this. If the client is in standing position, then I normally will use my thumbs. They'll usually be standing in front of me, and I'll have my thumbs just like this. And then from there, we'll go into an assessment technique. So the reason we go in here and assess SI joint is because it's one of these, another box to check off when I'm working with folks who have low back pain. It could be a restriction in this area. Now, I do want to note that finding the SI joint and assessing the SI joint may not necessarily mean that the joint itself is locked or subluxed or whatever you want to call it. It could mean that the complex in the area is tight, or the muscle tissue is so, for lack of a better word, contracted or locked up that there is there's not the normal range of motion in this area. So finding the SI joint and then eventually assessing can help you to create the strategies where you might actually be working the soft tissue to help this SI joint area. Hey folks, thanks for watching the Morales Method YouTube channel. If you want more information on relieving low back pain, please click on the link above for our online course. And if you want more recommended videos, then please click on the links below. And finally, please don't forget to subscribe. Thanks.